Hello, welcome to the StellaLife Innovator series. I'm Liz Lundry, and today I'm so happy to talk to periodontist and entrepreneur Dr. Jason Souyas. Dr. Jason's passion for his profession is reflected in his desire to share it with others. He's a former assistant clinical professor in the Department of Periodontology and Hygiene at the University of Detroit Mercy and is a co-owner and co-founder of Referral Lab business analytics software. Dr. Souyas educates dentists and hygienists and in 2023 became a faculty member at the PICOS Institute. He frequently presents to groups on business practices and periodontal therapy. Dr. Souyas is also in full-time private practice in Port Huron, Michigan. Welcome, Dr. Souyas. I'm so happy you're here today.
Hi, Liz. Thank you for having me. I really appreciate it.
Well, it's such a pleasure to talk to you today. So I'd like to learn more about you and what makes your practice unique.
So we practice in a small town. Port Huron, Michigan is sort of separated from Metro Detroit. We have a population of about 29,000 people, and it's been shrinking a little bit lately, along with the whole state of Michigan, but we've not too bad here in the rural area. We have a large rural area surrounding us. That's a lot of cash crop like sugar beets, corn, soybeans that people farm. And then the areas immediately around Port Huron. Port Huron's become kind of a retirement community in Michigan because of our wonderful access to the St. Clair River and Lake Huron. It's a big boating destination. So it's a wonderful spot where we're at. And really, with my practice, what makes it unique, many people knew my partner and mentor, Mark Setter. So I took over Dr. Sutter's practice in 2014 as the owner when he decided to retire. But I was fortunate enough to have 4 good years with him as a mentor and learned and soaked up every bit of knowledge and information I could from him. And he gave me a great starting base of where to begin. But what really makes my practice unique is my team of people. I have the best people. I'm very fortunate. We're very rarely do we hire people with dental experience. We find people with great personalities and great natural talents that we train in the skills of dentistry. And the one thing we all have in common is everybody here wants to be the best at what they do. So that's a wonderful part of our practice, and I really do feel like that shines through in our patient experience. They love what we do, they love being the best at what we do, and they love taking care of our patients.
That's great. Yeah, getting the right people with the right attitudes and just like their aura, then you can create this great team because all the rest is trainable. So, that's just such a great way to start. And also you had relationship with these patients for 4 years too, which is wonderful as you're taking over the practice. So it sounds
It's
like
been, yeah, it's absolutely been a fantastic since 2010, so 14 years that I've been here, and I can't imagine practicing anywhere else than where I practice now. So.
yeah, Michigan's got some beautiful parts. I've been there many times. It's gorgeous. And I think a lot of people from my neck of the woods, California, are maybe retiring out there. So I'm going all over, and
I
we're
have met a few patients from California that are like, "Hey, we came to Michigan." I'm like, "Really? Why'd you move to Michigan?" They're like, "Oh, taxes are a lot lower."
yeah, well, besides that, it is beautiful and you've got that, the lakes and everything else. So yeah, it's gorgeous. But tell us more about Referral Lab, also known as RL, and who could benefit from it.
Sure. Referral Lab is a software we created. I was the fortunate enough to be the first one to be able to use it in our clinical setting. It is not a practice management software. It is really designed to be a business analytics software. It was all there's 8 owners of the company. We're 4 of us are doctors. All 4 of us are specialists that are doctors. Jason Stoner is a periodontist. Michael Picos, an oral surgeon. Michael Seda is a periodontist in Marin, California, and myself. And then we had 4 people on the business side of the team. So 3 of the 4 are, excuse me, 2 of the other 4 are programmers. One is a hardware person, and then the last is Dr. Cameron, now Dr. Cameron Full. He's got his PhD in business administration just this month. And so that the team of us have been working on this we've been working on it for 4 years, but this is our third year of having a product that people can purchase and use in their practices.
That's wonderful. Yeah. So how is Referral Lab different from other business analytic programs, and how user friendly is it? How do doctors implement that?
So it was designed so most of the other analytic programs that are out there mine your practice management software to pull out certain data, right? So it's kind of automated, which makes it very easy to use. We decided to go the opposite direction. We wanted information that's not contained within the practice management software. So it runs in parallel with your practice management software and requires a separate entry. The good thing that we've done with that is we made the entry very, very simple. But from that, we're able to spin data in so many different ways. I think one of the common things is people get overwhelmed because when they look at the number of reports that can come out of the software, I gotta say it's probably in the 40s, the number of reports that we have. And we only really look at 11 different variables, but it's how you organize those, what date ranges you put on those. And the whole point of that is to know where your best patients are coming from.
Mhm.
And so as a specialist, that's typically referrals. But even though we are all specialists that own the software and really we designed the software to be something we wanted to use in our own practices to make our marketing efforts better, to pay attention to who we're scheduling and when. But 30% of our customers for Referral Lab are advanced general practice users. Because even though it calls it a referral in the software, it's really where's your treatment opportunities coming from? And so we call that referrals as a specialist, but in a general practice, that might be your hygiene department, or that might be a marketing campaign that you run. So it really does a great job of tracking where your treatment opportunities are coming from, and can even give you very specific information on return on investments for some of those things.
Yeah, that's really valuable information. Otherwise, you might be spinning your wheels and really wasting time and money on other marketing that just really doesn't give you much of a result. So it's great to have all those statistics there. So I imagine getting going with a new business of any kind has got all kinds of challenges. But what's the best part of being involved with a dental technology startup for you?
One, it was a nice change, right? Like we're as dentists, we're used to treating our patients, managing our practices, going home. This was something completely different, totally out of my wheelhouse. I didn't have any experience in this before, but knew I wanted to build something. I started, whether we ever sold another subscription to it or not, I started by building something I wanted to use in my own practice. The greatest part of it is getting to see things from both sides. So now I've had the opportunity to go to dental meetings, not just as a doctor, but as a vendor. And it's a completely different experience, as I know
It is.
you witnessed firsthand, and
Yes.
absolutely.
Yes.
And so it's nice to sometimes see that from both sides. But the best part of this is the difference this software is making in practices. Like I love this, that our first customer was an oral surgeon. And every time I see him, he comes up to me, and we've become friends because of this, but I didn't know him before the software. But every time I see him now at a meeting, he comes up to me and gives me the biggest hug. And he's like, I can't thank you enough for what you did to my practice. That we built that fact that we built a software that's changing people's practices for the better is absolutely just the best part of it for me, because I want to see dentists succeed. I want them to be everything they want out of their career. And as everybody talks about in our profession, we get zero business training when it comes to that in dental school. I mean, I think my practice management class talked about the differences in types of insurance. Well, there's a whole lot more to it than that, as we've all had to learn through the school of hard knocks over most of the years.
Right, absolutely. I've been a trainer with the JP Institute for over 30 years, and we go providing ADACE and working with the whole team, we focus on hygiene, of course, and hands-on stuff. But, with as well as with you're doing with the mentoring you're offering your doctors, being able to improve communication skills, putting in systems that are really working. And it's just so important. And then with the experience that you had with this oral surgeon, it's so gratifying to be able to help these offices and then seeing this long-term change with them. And, they're off like it's like a new practice all of a sudden when they have this insight and there's a plan in place and everyone's on that same page. So what you're
And
doing,
that, what
amazing.
you said about the systems is one of the things that was completely a side effect of the software. We started by not mining practice data because if you ask a room of 10 dentists what practice management software is, they probably got 11 different answers, right? And so we started just because we're like, well, everybody uses something different, even though there's some that are more used than others. But by doing that, what was a byproduct of the software was reproducible, structured systems around, at least for the specialists, the new patient process, and in the GP's office, follow up after treatment's presented and structure around getting new patients in or patients in for consultations. And that is where we've seen the biggest changes in those offices. Is many times before Referral Lab, we'd go into an office and visit, and we're like, well, how do you track new patients? And they'd pull out this 3-ring binder that was this thick. And they're like, well, on this pink tab of paper, we've got this, and on this yellow tab of paper, and we're like, oh my gosh, how does the next person come in and reproduce this, right? You can't. And that's what's nice about an organized software system is it's a reproducible, structured management system that puts those things to place in those practices.
That's awesome. And you're following your passion, which is helping everybody to succeed. And
Yes.
ultimately, the patients are the ones that benefit the most. So, thank you so much for sharing this information with all of us. So, we'll have this information on Referral Lab with this um, posting when your interview is shown. So, if you're listening in, please check it out. Check out Referral Lab and see how it can really help improve what you're all doing with your patients and your practice. And I think when we have things like this in place, it just makes life easier and more enjoyable. So it's just a benefit all the way. So thank you again for what you're doing and for spending some time with us today, Dr. Jason Souyas. Really appreciate you being here. And I want to thank everybody who's watching today and join us next time as we interview our next amazing innovator. Take care, everybody.